5 years ago when I was bigger, I used to eat things and I used to be like, man, I was sitting on the couch and afterwards I'm like, this is the life, you know? Now I do it. And if I eat bad, I eat 2 donuts or something. And I'm like, there, I was like, why did I do that to my body? Where before it was like a dozen donuts, it was fine. So, you know,
So you have just one more question. I'm going to let you close it out with the final thought here, but you have a very personal connection to, again, this niche or this specialization that you found. And right now, I feel like there's a pharmacist out there or a technician out there who's passionate about something. You know, maybe somebody close to them struggles with diabetes, or maybe there's physical therapy, or there's so many different avenues that somebody could be passionate about. But it's definitely easier to stay in the traditional streams. Do you have any advice or any thoughts to someone out there who's got that passion, but they're just, still doing the traditional grind?
Yeah. So, I mean, the first thing is find out exactly what you're looking for. So for me, it was a personal thing. It was like, okay, I want to help my community, but at the same time, I had to start with myself, right? And here I was, this big person. So I had to make myself a living example of what can be a possibility of what you can do. And so if there's something that interests you, that you want to do, people say, you know what, I want to be healthier. Let's just say a patient has like Crohn's disease or IBS or something, and they're like, I want to be able to help people because the doctors I'm going to is the same thing over and over again. Or I have a huge family history of cancer. Everybody in my family gets cancer and then they die. Everybody in my family has diabetes. So find out what that is, right? And then just say, okay, how do I become the best person for that disease state? And just focusing on one disease state. For me, it was obesity, right? So focusing on that one thing and say, okay, what can I do at this point to make myself better? Start going to seminars. I mean, I've done a lot of online seminars. I've done a lot of in-person seminars. And I still do it this weekend. That's what I did. Friday and Saturday, I was doing seminars on neurocognitive issues. So people with Alzheimer's, dementia, stroke. I was looking at traumatic brain injuries. But always be learning and try and become the expert in that field. But if that's the thing that you're looking for, study it, learn it inside out. That's the only way you're going to become the best at it. And once you figure that out and you're able to teach people, it makes you so much better as a clinician. So my patient that I saw on Saturday, I spent an hour talking to her about what we're going to do for her weight loss. And I go, I'm sorry that it took me an hour, but I like to explain, because I'm actually teaching myself when I'm teaching you and getting you to understand it all. And she goes, no, she goes, it made perfect sense, everything. And she goes, and you looked at all the little aspects of things that could possibly go wrong, or things that I'm not even thinking about, things that I think are a side effect, but it's not really a side effect. It's what I'm putting in my body away from the medication or whatever. So she's like, I love it. I love what you're doing. And so if you want to learn how to do anything, look at options, look at things. If it's on functional medicine, A4M, Institute of Functional Medicine is another one. Start just following people. Dr. Mark Hyman is really big. Pam Smith, if it's on obesity stuff. Jason Fung is a nephrologist out of Canada. He has an obesity code. People want to do like carnivore diets and just kind of see what different types of diets. Dr. Sean Baker's out there. And just start following these people and seeing what's going on, and then say, you know what, I want to start incorporating some of this into my practice. And again, this, where I'm at right now, is 4 years in the making.
How much better would any business, whether it's, a restaurant or healthcare or, any business, if you went in and the people who you were interacting with had that kind of passion and that, like, I want to be interested and be awesome and follow this and make this the best, that's such an amazing environment to be in anyways,
Yeah, I mean, when you take pride and you actually enjoy what you're doing, it's huge, right? You pay huge dividends, because everybody wants to be at a place that they feel appreciated, right? And they feel that it's yours, so they take ownership, right, of that business. I mean, honestly, everybody that I've talked to with you guys at Pioneer, a lot of you guys do that. You all take that ownership, and you're like, we're going to do what we can to make this the best possible experience for our customers. You know, I mean, I'm one of few customers out there. You have many, many customers, right? And I'm one of the few that you actually call on for just different types of deals and see what I'm doing. And then I call on you guys because I mean, I'm trying to start something brand new. And so I'm like, I need help, guys. And so being able to put yourself around people that can help you grow is what you want to do. People that are going to feed you the right information, the right personal positive growth that you need. That's what you want. You want to have that good.
Who knew some of those things they told us in high school would still be applicable as adults, you know?
Yeah, you know, I think about it, it's like, man, my football coach taught me to do this and actually be a leader. And I'm like, man, you know what? Okay, well, I'm trying my best to be a leader here. And so, you know, just looking back at everything and really, you know, pharmacy in general, that's why I ran for president-elect of the Texas Pharmacy Association, because I want to help change and improve the practice of pharmacy. I want patients to really understand that pharmacists don't just count pills. We don't. I mean, some people do, but there's so many pharmacists, especially a lot of these PharmDs, that were taught all this clinical knowledge that we're not using. We could help so many other people. We're highly accessible, and we just want to be part of the team. We want to be able to help the patients just the way the doctors do. How do we make this patient feel much better in what they do, whether it's with medications or not with medications? How do we reduce their risk? And so for me, it's like, how do I transform the profession of pharmacy? And the people like my uncle that are retiring, there's so many other people out there that are ready. They're like, we're out of here. We're done. But there's so many of this younger group, people that have been graduating from pharmacy school in the past 10, 15 years that have been waiting for a moment to get out there and show what we can do in the clinical space. Not just in the hospital. We see it in the hospital all the time. The doctors love it that the clinical pharmacists are with them, but there's nobody on the outside space that can help them. Well, there is. The thing is, they just don't know we're out there. And so that's what I'm out here for. I'm out here working with all the physicians in my area, telling them like, look, this is what I'm capable of doing. Help me help your patients. Put me in, and I want to work with you guys.
Put me in, coach.
Put me in, coach.
All right, Michael, let's close it out. Thanks so much for joining us. And everybody out there, remember, you are what you eat. Thanks for listening to this clip from Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.